Hello, DBC peeps, and welcome to this week's episode of Dentist Brain Candy. I am your host, Dr. Brian McClelland, and thank you so much for tuning in. You've probably noticed here in season 2 that we've added to our repertoire to include a YouTube channel titled Dr. Jawbreaker. Now, Dr. Jawbreaker is going to be a combination of episodes like this that are generally geared more towards the dental professional, and then the videos of surgical procedures, which are geared towards the dental professional and just anybody that's interested. There will also be just the audio version of this available on any podcast player that's out there, Stitcher Radio, iTunes. Remember, if you can go and leave reviews, that really does help bring more people to this program and helps them find us, and it's greatly appreciated. Of course, on YouTube, I believe thumbs up, leaving a comment down below, and subscribing is also very helpful to get the word out about this program. And if you enjoy this and want more of this, then this is your way of letting me know that you're out there. So pause this right now, go get that done. Couple of announcements here before we get moving. COVID has been quite the nuisance over the last couple of years, although I believe we're getting near the end of all of this nonsense. And I say that tongue in cheek. But we have some live events coming. We had a little hiatus, but we're starting again. So February 18th, that's right, coming up, February 18th, 2022, we're gonna have an OSHA update, a CPR renewal, HIPAA Lunch and Learn, and then 2 afternoon speakers. One of them is myself. I'm going to be speaking about wisdom teeth, maybe 30 to 45 minutes, indications for referral, timing of referral, reason for extractions, update on the science behind wisdom teeth, removal or not removal. In October 21st, for those of you that can't make it in February, is going to be the exact same program again. These are all going to be held in Post Falls at the Red Lion Templants. It's a pretty cool venue. It sits right on the Spokane River in Post Falls, Idaho. You guys probably already know this, but I have 2 practices with Dr. Olson and I, one in the Valley and one in Post Falls. So this would be a nice way to get people back together again and get some CE credits. Now, we are going to be streaming this on Facebook Live. If you're in person, you can get CE credits. You're welcome to attend live if you wish, but there's no CE credits available for those attending live. So February 18th and October 21st are the dates of those 2 events. May 13th, Noble Biocare is sponsoring an event, and this event will also be at Red Lion Templants in Post Falls. And we're gonna have Ken Parrish being one of our 2 speakers on that day, and his talk is titled Unlocking the Power of Innovation. Understanding the benefits of Tri-Ultra and the Zeal surface technologies. Discover how the new implant topography promotes early osseointegration. Learn the role of DTX Studio, which is a software for treatment planning and its ease of use. In the afternoon, we're gonna have Ian McNichols from WEO Media, probably pronounced WEO Media, I don't know. Best practice for driving new patient growth and how to get new patients for all this new implant technology that you just learned. All right, hope to see you guys there. Also want to let you guys know about Jet Virtual Consults. Jet Virtual Consults is an app that I had developed for my practice, and it has been phenomenal. And the whole idea of this app is more than just the video consults. This app will increase your productivity by 10 to 15% at a minimum. It will help you collect patients' health history, their surgical history, their medical history before even showing up at your office. They can take pictures of their cards, their insurance cards before they come in, or anything else you want them to take a picture of. They can review and sign your financial policy. They can review and sign your HIPAA policy. And that's right, you can have your own forms within this app itself. If you're doing a surgical procedure like extraction of wisdom teeth, dental implants, jaw surgery, etc., there are informed consent videos that are available as well. And then it helps you collect reviews and increase the number of reviews that you have by doing a screening process to make sure patients that are happy, 4 or 5 stars or greater, are directed to the internet to leave an online review for you. And then the grand finale, of course, is the ability to do a video conference or video teledentistry / telemedicine consult that you can get paid for, so the patient can do this from the comfort of their own home or wherever they wish. Currently, I mandate 5 consults per day that are virtual. The average cost of a turnover of a room is somewhere in the $50 to $75 range. So if you do 5 consults a day at $50, that's $250 that's saved just right out of the gate. Not to mention the increase in productivity. I was able to do the same number of consults in 1 hour less time and do 1 hour's worth of more surgery, which massively increases my productivity. So if you want to learn more about that, just go to jetvirtualconsults.com or email me at brianmcclellan@hotmail.com. To go back to the CE events, if you want to register for those, just email at info@libertysurgerycenter.com or go to Eventbrite and search for Liberty Oral Surgery CE events. I do recommend emailing. It's probably a little more predictable at this point. Now, the first thing I'd like to talk about today is trigeminal neuralgia. Now, trigeminal neuralgia, a really nice review article in the JOMS, that's the Journal of Oral and Maxillofacial Surgery, pages 2378 to 2371. The article is short and succinct, but quite useful. So this article is by Ellie Farini. So trigeminal neuralgia is a long-lasting facial pain disorder that affects the trigeminal nerve. Clever name, trigeminal neuralgia, trigeminal nerve. And even mild stimulation of the face can cause severe and excruciating pain. Initially, it is experienced as short, mild attacks, but this pain disorder can progress, causing longer and more frequent bouts of pain and discomfort. Trigeminal neuralgia affects men more than women and is likely to occur in people who are more than 50 years of age. The symptoms include involving one of the 3 branches of the trigeminal nerve, which include the ophthalmic nerve, or V1, the maxillary nerve, or V2, and the mandibular nerve, V3. 1, 2, or all 3 of these can be affected individually or at the same time. However, trigeminal neuralgia commonly affects the mandibular and maxillary branches only. The symptoms include one or more of the following patterns: pain in the cheek, jaw, teeth, gums, or teeth. Pain usually affects one side of the face. The episodes of pain are severe and shooting that may feel like an electric shock. The pain can last a few seconds to several minutes, and the pain can be focused on one spot or spread to a wider area on the face. Sometimes there are trigger points associated with this. Some of the triggers which may set off pains include eating, drinking, smiling, brushing teeth, talking, touching your face, or washing your face. Causes, the causes listed in this article is by disruption of the trigeminal nerve. Now, I'm never really a huge fan of a cause like that. I mean, that's just so vague. Trigeminal neuralgia is caused by a disruption of the trigeminal nerve. Most commonly, the problem is contact between a normal blood vessel and the trigeminal nerve at the base of your brain. The disorder can also be a result of just aging, and people with multiple sclerosis do have an increased incidence of trigeminal neuralgia. So if you have trigeminal neuralgia, oftentimes it includes seeing an oral and maxillofacial surgeon and or a neurologist and or a neurosurgeon. The treatment includes non-surgical and surgical approaches. Non-surgical modalities include medications. And these medications can include things like Tegretol or carbamazepine, amitriptyline, baclofen, which is a muscle relaxant. And although it's not in this article, Neurontin or gabapentin is also used for the treatment of trigeminal neuralgia, particularly in my area. Surgical procedures are divided into 2 categories, either open procedures or lesional procedures, or lesioning procedures. So open surgery includes microvascular decompression, and it involves surgical exposure of the trigeminal nerve root by a neurosurgeon, decompressing the nerve and movement of the blood vessel away from the point of compression. This may result in relieving painful episodes and return to normal nerve function. Lesioning procedures. There are many minimally invasive procedures that can be used to treat trigeminal neuralgia patients. Percutaneous radiofrequency rhizotomy is one. This minimally invasive technique uses heat to relieve pain by destroying the part of the nerve that causes pain. The surgeon passes a small needle through the cheek into the trigeminal nerve and uses the heat current to destroy some of the nerve fibers. The percutaneous balloon compression This technique uses a needle that passes through the cheek to the trigeminal nerve. The surgeon places a tiny balloon, then inflates it. The inflated balloon compresses the nerve and injures the fibers that cause pain. Percutaneous Glycerol Rhizotomy. This technique uses a liquid agent, Glycerol, to selectively damage the nerve. This interferes with the transmission of pain signals to the brain. Keep in mind that all of these will lead to some level or degree of paresthesia and permanent numbness. And then there's procedures that are stereotactic radiosurgery, such as gamma knife or cyber knife. This procedure delivers a single dose of ionizing radiation to a small precise target at the trigeminal nerve root. This ultimately interrupts transmission of pain and signals to the brain. All right, the next thing that I'd like to discuss is really just an article, a contemporary article about a surgeon, an oral and maxillofacial surgeon named Eduardo Rodriguez. And this individual is quite impressive, is quite accomplished, and is doing face transplant surgery. And actually was recently the quarterback for a face transplant and a hand transplant surgery. Yes, you heard me right, face and hands at the same time. So this was out of Amos Today in the most recent January release in 2022. And the article goes like this. Dr. Rodriguez starts off by just saying that the first time he saw in a small animal model that's a facelift, or at least a partial facelift, could be done, he was thinking, wow, how do we get this to clinical trials? Roughly 17 years later, as head surgeon, Dr. Rodriguez led more than 140 healthcare professionals at New York University, NYU Langone Health, in conducting the world's first face and hand transplant. A 22-year-old New Jersey burn victim received a donor's hands and a full face during the 23-hour surgery in August of 2020. In total, Dr. Rodriguez has led 4 face transplant procedures. The latest surgery. Patient Joe DiMeo suffered third-degree burns over 80% of his body in a 2018 car crash after he fell asleep on his way home from a night shift as a product tester. After about 20 reconstructive surgeries, the 22-year-old had severe facial scars, no lips or eyelids, and amputated fingertips. With the goal of transplanting the patient's face and hands, the surgery posed the most complex operation Dr. Rodriguez has ever performed. 2 previous attempts by other surgeons to simultaneously transplant a face and hands were both unsuccessful. The first patient in 2009 in Paris died a month later because of infection. In 2011, a transplant in Boston, Massachusetts treated a woman mauled by a chimpanzee, but her hands were removed days later. The team rehearsed the surgery in 2019 until the COVID-19 pandemic hit, and at NYU Langone Health resources, and attention turned towards treating for those emergency patients, and DiMeo's transplant was postponed. Can you imagine having yourself as the surgeon, as the doctor, and especially as the patient, all psychologically prepared, man, you're ready to go. New face, new hands, knowing that this has only been done a handful of times and that you could die, being postponed. Dang, that's something else. I'm gonna try to show you some pictures here of what this guy's face looks like in his pictures. But, you know, the whole mantra of this was that failure is really not an option. Failure equals death in this particular situation, or quite possibly death. 6 surgical teams, including one for each hand and the other for the face, simultaneously operated in the donor and recipient rooms. So if you think about that, you've got like a donor, one team procuring one hand, one team procuring the other hand, another team procuring the face. That's 3 teams. Now on the patient, Joe DiMeo, you've got one team that's going to work on one hand, one team that's going to work on the other hand, and then Dr. Rodriguez working on the face. The 16 surgical team and the 80-member OR team transplanted the hands to the mid-forearm and the full face, including the ears, the nose, so the ears, the nose, the eyelids, and the underlying skull. Dr. Rodriguez said the surgery went better than expected. Craziness. Let me show you some pictures. All right, so here's a picture of our handsome Joe. Man, good looking fella. And then the injuries. Check that out. What a change. What a difference. If we go up here, there's some 3D planning that was done and some modeling. Sorry, my fingers are over that, of what was going to happen. All right. I want to show you, actually at the end here, I'm going to show you what he looks like. The surgery for the face and transplanted hands lasted 23 hours. And then the patient looked at his face. Before and after the transplant photos are coming your way. I'm going to make you wait. All right. So DiMeo is now doing well. He's extremely motivated. They do a whole bunch of psychological and social testing ahead of time and counseling to make sure the patients are adequate and well chosen for these procedures. He's now lifting weights. He's petting a dog. He's actually grasping objects. That means his hands have some level of movement. Crazy. And he grasps objects such as balls and he moves them. As soon as we can get him off the pain medications he wanted to be off, said Dr. Rodriguez, he still has that same spirit. He's a fighter. He'll always tell you that he doesn't give up. It's not a cliche. He's got the right attitude. We're very, very proud of him. History of transplants. I'd like to give you just a little touch up about that, or a little information about that. Human face transplants pose a relatively new world. Yeah, no kidding, huh? And new challenges with fewer than 50 operations performed across the globe. The first partial face transplant was done in 2005 by an OMS, Bernard de Vachevel, a plastic surgeon, Benoit Langale, and a transplant specialist team, Jean-Michel Dubernard, in France, to treat a woman that was mauled by her dog. They replaced the patient's nose, chin, and lips. The patient died in 2016, and this was done in 2005, at the age of 49 after experiencing infections and developing cancer. A team at Cleveland Clinic performed the first U.S. face transplant and reportedly the fourth in the world in 2008. In a 2008, on a woman shot by her husband in a botched murder-suicide. It was a 22-hour operation that involved the nose, the eyelids, the skin, the muscles, the teeth, and the nerves, and was at the time considered the most complex face transplant, according to the Institute. Patient died in 2020, that's 12 years later, at 57 due to an infection unrelated to her transplant. In 2010, the first full face transplant was conducted in Barcelona, Spain. The 24-hour surgery was conducted on a 31-year-old man injured in a shooting accident. The first full face transplant in the United States in 2011 at Brigham and Women's Hospital in Boston treated a 25-year-old man whose face was severely injured when as a cherry picker, he touched an electrical wire. I just imagine this guy in a cherry tree picking cherries and his face touching some wire and electrocuting him. Man. A 30-member team conducted this 15-hour surgery that transplanted the skin, nose, lips, as well as the underlying muscle and nerves from an anonymous donor. Rodriguez performed his first human transplant in 2012 at the university. It was a 36-hour surgery. Compared to Rodriguez's first face transplant, this procedure was definitely shorter. Let's see, 36 to 24 hours. Yeah, that's a lot. Still, 24-hour surgery, man, that's kind of something else. Compared to Dr. Rodriguez's first face transplant, this surgery was more than 11 hours shorter. The length of stay was about 25 days in intensive care unit, and by 28, rehabilitation for 6 days. Patients submit requests for transplant at NYU with careful evaluation by a clinical psychologist, psychiatrist, and ethicist. A large team is involved in patient selection, and patients must understand the consent process very well. But the operation offers a patient a new chance of living, said Dr. Rodriguez, explaining he is clear with them and that he is unsure with how long they will live with the transplant due to potential complications and issues related to undergoing operations, including infections and the effects of long-term medications. The future of these face transplants, man. The first face transplant he led, Dr. Rodriguez led, was 36 hours, while the most recent one was 23 hours. Dr. Rodriguez said he does not become tired during the long surgeries. He's running on adrenaline. He takes breaks to drink coffee and to use the restroom. It's glad to know that at least he's human. As for the future, other opportunities are subunit face transplants, transplanting portions of the face or the jaws, including skin or bony tissue. I think the major limiting factor in these patients have been the lifelong medications that could potentially compromise their lives. And what Dr. Rodriguez is talking about here is that despite doing testing and making sure that they're an adequate match, and that would be a fascinating discussion all on its own, they still have to take things like immunosuppressants like tacrolimus and Prograf, etc. So I just thought that this was like an amazing article, and I'm so pleased that an oral and maxillofacial surgeon is kind of one of the leaders in this, really in the world. This Dr. Rodriguez is fantastic for our specialty, is doing courageous, really just courageous work, only overshadowed by the courage of his patients that are moving forward and doing this. Now I want to show you the before and after picture. And we know that this patient's a rock star because they're clearly a Boston Bruins fan. So check this out. Get a good feel for where he was before and where he was after. The success of that. Check out those arms and hands. Love the tattoos. Love how healthy and normal those hands look. Definitely some contractures there. I'd love to, know more about that. But anyways, check that out. Hope you love this article as much as I did. Well, guys, that concludes this week's episode of Dentist Brain Candy. I want to remind you about something that is current and pressing. If you're interested in a continued discussion about how to generate income outside of the practice of dentistry and oral and maxillofacial surgery, contact Chris Salazar. He is a friend of mine that currently has an investment. The name of his company is Archstone Capital. If you email me at brianmcclelland@hotmail.com, I'll get you in touch with Chris. He currently has like a 57-unit apartment building that he's looking for an additional $300,000 worth of investment, which will generate significant cash flow on a monthly basis. I haven't looked into this particular deal yet, but every deal Chris has sent to me has at least an 8 to 10% preferred return for the investor. So, and that's on an annualized basis. So if I do some quick math, 10% is an easier number. 30,000, that's 300,000 is $30,000 per year once stabilized. So that means roughly, once the project is completed, which means it's a value add. In other words, there's stuff that needs to get done. It needs to be fully tenanted. 300,000 is going to translate into $30,000 per year. You do 30,000 divided by 12, and you are, well, if it's 36, it'd be $3,000 a month. So you're somewhere in the, just going to spitball like $2,300 to $2,600 a month check in the mailbox by making this one investment. You can use IRAs, you can use 401ks, and I'm just telling you what I'm doing for investments. Of course, you got to know that I am not an investment advisor. Talk to your accountant. But no, I've never heard anybody and any of my friends or colleagues come and present these kind of things that have been vetted by someone that I know and trust. So hopefully, you know and trust me. This is stuff that I'm investing in. So just email me at brianmcclelland.com or brianmcclelland@hotmail.com, and I will get you in touch with Chris. Keep in mind that this investment is time sensitive, although he has other investments coming and projects coming in the future. If you want this one, you got to jump on this thing fairly quickly to get the information. So thank you for tuning in. I hope you like this. Please leave the reviews, high star ratings, comment down below, all the good stuff to make this become seen and known out there in the big bad world. So appreciate it. Catch you next time and see you on the flip side.